Welcome to Open BxRx Tuesday on BronxNet. I'm your host, Kibin Alleyne, and I'd like to invite you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. Hearing the school bell was not the way some New York City teachers wanted to ring in the new year. As cases of Omicron, the COVID-19 variant, continues to rise, New York City teachers fear for their safety. Joining me to discuss a demand of teachers calling for a remote option is social studies teacher and UFT Solidarity member Lydia Howrilka. Lydia, thank you so much for joining me.
Thank you very much for having me.
So, you are among several teachers who were apprehensive about returning to in person classes for 2021. Can you explain how those feelings began for you?
Well, a couple days before the start of the new year, Mayor de Blasio and Mayor-elect Eric Adams and Chancellor Misha Porter and Chancellor Banks released their safe the plan that they basically had to reopen schools safely at the start of the 2022 year. And unfortunately, due to lack of testing options, many of our students are unvaccinated. There have been tremendous cases of Omicron breakthrough infections happening for both staff and students, all New Yorkers across the tri-state area. Many teachers really were hesitant about going back in the wake of this surge. We saw a great drop in attendance leading right up to the Christmas holiday. And we predicted that there would be a similar lack of attendance leading up to, coming right after the new year. There have been many issues regarding teachers getting appropriate PPE, testing when when requested. Certain staff members have been telling UFT Solidarity that they actually been turned away from testing when Test and Trace has come to the school. Not all students are being tested. It's a very small sample, actually, and not all parents have submitted consent forms. So essentially, a lot of students are not being tested. So there's a lot of cases of COVID that are being underreported in the DOE. So the DOE says that New York City schools are, quote, the safest place for kids to be. But as educators on the ground, we know that's very far from the truth.
So I want to kind of elaborate on that because before we get into the return of schools after the past winter break, I like to just recap on the end of the school year. Last year, before school began, the mayor assured families and school staff that it would be a much safer school year than ever before. And many things were promised, such as HVAC systems and daily cleaning. As a New York City teacher, do you feel that was delivered?
Definitely not. COVID, as we know, is airborne. And many of our schools, unfortunately, are over 50 years old, close to 100 years old. My own building is 80 years old. And our ventilation system are windows. In many classrooms, our windows don't work. In many schools across New York City, we do not have appropriate HVAC or any kind of ventilation system. The only way you get air is through open windows. Many teachers for the longest time thought that air conditioning units were ventilation, but now, of course, we know that they are not. There's just so many things the city promised us. The city promised us to upgrade school campuses. That never happened. We know it's very expensive. We know it's a wish list, but at the very least, can you at least shrink class sizes? The city said, "Oh, we'll give you smaller class sizes. We'll flood schools with more money," but not all principals hired enough staff. There's not enough space for these smaller classes, and where can you hold all these classes? Schools that are in co-located buildings. That means multiple schools are sharing one campus. They don't have enough space for everybody. So we are promised all these things: HVAC systems, quality air purifiers, adequate testing. All these things were promised to us and they never happened. So a lot of teachers, including myself, are upset. We are disgusted, and we truly feel that the city does not have our best intentions at heart.
Now, I understand you took a poll through UFT in regards to teachers and testing. Can you elaborate on what you found?
Yeah. So we tested our own membership and non-affiliated UFT members. This was a totally anonymous survey. It was optional for you to list your school, although a lot of members chose to list their school regardless. And we have found that 95% of teachers polled, and we polled over 300 teachers and school staff members, that testing was never announced. It was always this big surprise. You would hear it over the loudspeaker saying, the testers have arrived. Students who have a blue card, please report to this room. And last year, teachers were able to get tested whenever they wished, which is great. But this year, it's if you don't have a prep or a lunch that period, you are out of luck.
Wow. Now, according to reports, despite filing a temporary restraining order against the DOE, you still return to work. Can you explain your decision to still go to work, as we can see that, you're probably in a school setting now? Can you just explain what that feeling was like, even though you had these really strong feelings?
It's hard. I mean, I am a devoted educator. It's the core of my existence. It is part of my identity. But I'm also an activist. So I feel that I need to understand what my members are going through by being in the building, by being on the ground. And even though I'm fearful, today I took one of the rapid tests. Thankfully, I'm negative. That could change by the end of the day today. That could change by tomorrow. So I just be as careful as I can. Right now, I have all 4 windows wide open in my classroom, and I have fresh air blowing through. Thank goodness for that. Otherwise, I will be delivering this interview to you in a KN95 mask, because that's how I spend most of my day, in a KN95 mask with my students, covering classes when my colleagues are out. And it's just horrifying. I mean, the mayor says that, that students need to be in school, but guess what? Students can't get a good education if their teachers are sick and absent. Students can't get a good education if they themselves are sick. It's an absolute crime, the fact that we cannot have remote learning, at least for 2 weeks, until we can understand and figure out where is Omicron going. We haven't hit the peak yet. We probably may not hit the peak until the end of next week. It's ridiculous. It's ludicrous. Teachers learned how to make remote instruction work in March of 2020 to the end of last year. We made it work. We learned how to engage kids. There's no reason why we can't do remote instruction for emergencies like this. This is an emergency. We may not be in an actual snow blizzard, but we are in a viral blizzard, and we need to be safe at home.
Now, why do you think the city is so against going back to remote learning, even when it's temporary, like the 1 week or 2 weeks that you were hoping for?
I think the Mayor Adams, doesn't want to start his first term by angering parents. There is a very loud, vocal minority of parents who are part of this Keep Schools Open crowd, and they themselves are fearful because they fear learning loss. And granted, remote learning isn't for every kid, just like in-person learning isn't for every kid. But can your kid learn if they're in a hospital bed? Can I teach if I am in a hospital bed? No. We can have a happy medium. We can keep remote instruction for the kids who need it. We have homeschool for kids who need it. We have remote instruction for kids who have a diagnosed medical issue. If remote instruction works for those kids, why can't we broaden up to any kind of kid whose parent feels that they need this, right? Why can't we have remote instruction for teachers, open up to teachers who have medical issues, who are scared of being in their unsafe buildings? Have these teachers deliver remote instruction. They will be able to do what they love, and that is teach, and they'll be able to help the most needy kids who need that remote instruction.
Now, in a letter to families, New York City school chancellors Misha Porter and David C. Banks write, beginning January 3rd, schools will distribute free take-home COVID-19 rapid test kits to any students or staff who exhibit symptoms. Do you find this to actually be helpful?
It's one small thing, but if they were really serious about keeping schools safe, they would have a universal test to return policy. If you wish to return your kid to school, you need to have your kids submit a negative COVID test. My colleagues who have young kids in daycare have told me that in order for them to send their kid to daycare this week, they had to submit proof that their child was negative on a PCR test, not a rapid test, a PCR test. We have found through scientific studies that Omicron is not as easily detected via rapid tests as Alpha and Beta variants were for COVID. So the fact that they are giving us a rapid test is great. But since most people are coming down with the Delta and Omicron variants, and science is telling us that these tests frequently give out false negatives when people could be asymptomatic or symptomatic and maybe positive, if the test isn't telling you that you're positive, you could be going around school infecting your colleagues, your peers. There's so many students who struggle with wearing a mask. I asked the chancellor to spend a day in a New York City high school, stand in the hallway, and count how many students are not wearing a mask properly. How many noses do you see? How many mouths do you see? It is hard for a child to wear a mask all day, especially when there's not good ventilation to keep them comfortable all day. I understand. It's hard for me as an adult as well. But in light of this emergency, if you want your kid to feel as safe as possible, especially after traveling for the holidays, give them a chance to get a COVID test, a negative COVID test, if you're so against remote instruction.
Now, the state of COVID continues to change rapidly, and people have differing opinions on how the situation should be handled. How are you hoping the city plans to move forward with public education?
I would love for us to actually have mandated vaccines for kids. But I feel that based on what we've seen through Omicron, vaccines are not, a silver bullet to keep us safe from COVID. We need testing. We need reliable testing. We need healthcare. We need a lot of wraparound services to keep our kids safe. We need fully funded community schools. Our national government gave our state and city governments a ton of money, and this money has not been used properly and has not been seen in schools. We suspect, my colleagues in UFT Solidarity and the United for Change Coalition suspect that this money is being tied up to be used in district offices. If you want education to be fully funded and every kid to be given a fair shake, schools need to be given this money directly. We don't need the money tied up in bureaucratic or district offices. But this money needs to come into the hands of responsible principals and teachers and administrators in schools who know how to use this money to help their communities.
All right. Lydia, thank you so much for joining me to discuss this really important topic.
Thank you. Thank you. Thank you. Thank you.
We'll be right back with more Open BxRx Tuesday.